Hi, my name's Sarah Logan. I'd like to tell you about my Florence journey, an account of my time completing my Florence Nightingale Foundation Emerging Leader Scholarship with sponsorship from Public Health England. Let me introduce myself. I started working for the NHS in 2004 as a healthcare assistant. I then went on to complete my registered nurse qualification and qualified in 2008 as a registered children's nurse. Upon qualifying, I went to work in paediatric intensive care. And then, in 2009, I was offered the opportunity to move into the community as a Band 5 community nurse for school nursing. Then, after spending considerable time working my caseload and gaining skills in my field of work, I went on to complete my Bachelor of Science in the Specialist Community Public Health Nurse as school nursing pathway. I embraced my position within school nursing to give children and young people a voice, to work with them at their vulnerable times, and also be an advocate for the service to highlight the skilled workforce. I was inspired to lead and to be a positive role model, and in 2014 I received my Queen's Nurse Award for work that I completed with young carers and the Queen's Nursing Institute. I continued my passion and drive for better outcomes for children, young people and their families, and in 2016 I was awarded the Cavell Nurses Leadership in School Nursing Award. I moved into leadership in 2016 and became a team leader for school nursing. It was here that I displayed my commitment to service design and implement new initiatives to practice whilst undertaking the Florence Nightingale Foundation Emerging Leader Scholarship. During team leading for school nursing, I was fortunate to be involved in strategic objectives and follow the service as it was being redesigned. I was able to give input to this redesign and showcase the school nursing team and the role we play in enhancing the lives of our young people and the cohort. At the end of last year, I made the move into higher education. I have always loved mentoring staff and colleagues and looking for ways to improve service, and working with young people gave me enormous pride and a sense of achievement. The move into higher education has enabled me to become a lecturer for school nursing. I'm fortunate to work with future 0 to 19 practitioners and share knowledge and encouragement for the role. I'm also a personal tutor for pre-reg students, and I am supporting them through their journey of training during the most challenging of times. All of my roles have been rewarding to me, and I continue to learn in all opportunities presented. My personal journey with Florence, I have captured some of the moments on the slide as you can see. The group picture is the Florence Network, the Florence 22. We are an amazing group of women and we have supported each other throughout our journey, and I have no doubt will continue our wealth of knowledge, inspiration and compassion for each other. To be part of this cohort is humbling, and I know that this has had such an impact on me. I have also had the privilege of meeting incredible leaders, such as Dame Elizabeth Onwu, who told us about her journey into nursing and how she wanted to make a difference. Her story was incredibly moving, and actually it started with her getting help from school nursing, and I had the opportunity to speak with her after the presentation, in which she was lovely to speak to and so inspiring and courageous in the work that she did. I also had the privilege of meeting our chief nurse, Ruth May, who shared her vision and her journey in nursing, and both ladies demonstrated how they'd reached their goals and continue to learn and lead at the same time. Truly inspirational figures. RADA was part of our journey, and we went to RADA, and this gave me the skills to pause, to focus, and also to have a presence. It allowed me to look at myself and use strengths that I didn't know I had. It gave me tools to use when I needed them and strategies to think about when necessary. As part of my bespoke leadership training, I went to the Ashridge Leadership Academy, and this was another impact point for me. The time at Ashridge allowed me to consolidate a lot of my thoughts about the kind of leader I wanted to be. I took from this course the impact of storytelling and patient journeys, something I believe very passionately about. I was also able to study and reflect leadership styles on a much deeper level and recognise strengths and how to work with obstacles. This course was discussed with my mentor, who'd suggested this route for me, and I was grateful for her input and advice. My scholarship has impacted on me as a practitioner by giving me resources and examples, and that has allowed me to build my confidence. I continue to be curious about processes and objectives for school nurses, and I look for ways to be innovative for the benefit of the service and to drive things forward. It has also given me time to reflect on my own practice and what I want out of my career and reevaluate my personal goals. It also put me in touch with a network of like-minded individuals, of which I am grateful to be part of such an inspiring cohort. Part of the scholarship was to work on a project, and my project was to introduce the school health profiles to my area of work. A school health profile can be done with both primary and secondary schools, and it's almost like an individualised care plan for schools to help support students with public health issues. The profile was working alongside the senior leadership team in schools, looking at the school demographics and public health data, and identifying 3 key priorities for a targeted approach throughout the academic year. This equated to 1 topic per term. Once themes or priorities were identified, appropriate services were brought into the plan, led by school nurses. This could have been support from the child and adolescent mental health or the healthy lifestyles team. This was part of a wide engagement with the integrated partner agencies and working with our commissioners. My project was to introduce the profiles to the service and the wider team, to lead on its introduction and roll it out fully across the service. I did this by bringing the team together and discussing the project, asking for feedback and input from my colleagues, and also put together a SMART plan which would identify delivery and the timescales around it. During the project, I reviewed the uptake of the plans and worked very closely with the Public Health Local Authority team so that partner agencies could be introduced and work within the schools and for the identified priorities to be completed. I also worked with commissioners, and this was to embed the piece of work within the core business objectives for the service redesign, with the plan including review processes and new priorities being set annually as part of their updates. And as you can see from the slide, my project came from looking at the evidence and looking at national policy, and the fact that public health nurses have a significant role in leading and coordinating delivery of public health interventions to address the individual and population needs. The impact on the service users. When I saw the project and when I saw its results, we actually raised the profile of the school nurse service within all areas of service provision. The uptake results of our profiles across the borough was 80%, and that was using both primary and secondary settings. By leading and facilitating positive working relationships with schools, this resulted in school nursing teams being able to offer brief intervention work and referrals to specialist services where necessary. As I've said, previous partner agencies such as Healthy Lifestyles or Child and Adolescent Mental Health. The feedback from our schools who participated in the profile work stated they had felt reassured and supported by the school nurse team, whereas previously they had not been too sure on who to contact if health information was needed. And we gathered this feedback via focus groups within borough working as a form of identifying and measuring outcomes. We identified themes of prevalence of public health inequalities, and we worked with those schools to improve the outcomes. And by looking at the public health data as that integrated team, we would ensure support was being put in those areas needed. The increased visibility of the school nurse service also benefited for our children and young people via the drop-in clinics. By identifying the need for a school nurse drop-in during the profile work, this facilitated the option to secure a venue and advertising within the school to highlight the service for the children and young people. This saw an increase in young people accessing our service opportunistically, and this was promoting a preventative support for young people who use the drop-in clinic when needed. And we also worked with schools to increase their uptake of childhood immunisation programmes within the school setting. This promoted awareness within schools to ensure that the maximum uptake was obtained, and by schools working with the school nursing team, we encouraged a higher return of consent forms being returned, and the school nursing teams were also able to conduct assemblies to young people with immunisation information and also to alleviate any worries, concerns or queries. We were also able to signpost our school nurse drop-in should any young person wish to speak to a school nurse privately about any worries they may have had. I would like to thank the Public Health England for this incredible opportunity and give special recognition to my mentor, Wendy Nicholson, who has supported me through this journey, who has demonstrated positive role model in making a difference to children and young people and being there for advice and guidance throughout my journey. I am extremely appreciative of the opportunities this scholarship has given me and the resources and networks I have made to develop my leadership skills further and to seek out new ways of working to be an advocate for young people in the school nursing service. I am excited to continue my journey of leadership within my new role and to inspire future school nurses to lead and develop their own services to support better outcomes for our children, young people and their families. Thank you very much for listening.